no secret, many parents, they struggle to balance their kids' diets. Those picky eaters are the focus of a new University of Michigan Health CS Mott Children's National Poll.
Yes, and joining us live is Mott Poll co-director Sarah Clark. Hey, Sarah. So thanks for joining us this morning. And please just tell us the key findings about this study.
So just as you said, parents do struggle with trying to get their kids to eat that balanced diet. And a lot of them are turning to dietary supplements, things like multivitamins, probiotics, things like that. And we just have to remember, always the best way is to get kids to eat a rainbow diet, right? All those fruits and vegetables, small amounts of sugar. And of course, the challenge for parents is how to sneak that in.
You know, we know a lot of, 2 and 3 year olds, and they can be tough negotiators when you're trying to get them to have that rainbow diet. What do you suggest that parents can do when they're trying to, get their kids to cooperate when they're not hiding it in their food?
One of the things that experts recommend is engaging kids in helping to put the food on the table, whether that's having a little garden or letting them, clean off the vegetables or anything that gets them connected to that food, maybe make them a little more willing to try it.
Were there any findings that were surprising to you?
The biggest finding that was surprising, and I would say concerning to us, was of the parents who had been giving their child some kind of dietary supplement, less than half had talked with the child's pediatrician or other healthcare provider. We need to be having those conversations because the pediatrician can help the parent understand, is a supplement truly necessary? And then how to pick a supplement that would be appropriate for the child's age and dietary needs.
All right. And now I know when you have a picky eater, a lot of times cost could be an issue as well. Could you talk about that?
Yeah, about half of the parents in the study said it is expensive to feed their child a balanced diet. And it can be really frustrating for parents when they pay for that healthy food and then the child doesn't eat it. So parents might think of how to keep working for strategies. Maybe you make those smoothies that have some of those vegetables in. Keep working because we really do want to have kids get that rainbow diet. But I get it. It is hard on a day-to-day practical level.
I got a question for you. So, when we're talking about mac and cheese and chicken fingers and French fries, those are all of our favorite comfort foods. So when you like it yourself, how do you sort of, show your kid, you give them a good example when you, of course, like to chow down on those things yourself?
That is so much of being a parent anyway, right? You have to remember you are that role model and everything in moderation. So it is taking the plate and making sure that there are many things on it, not just the fries and chicken fingers. You can do it, parents.
Okay, I know you couldn't see the video, but as you were saying that, there was a little boy trying Brussels sprouts, and he wasn't happy about it. Not impressed.
And they don't have to eat every vegetable, right? Find the ones that they like at that age. And the thing that all parents know is it changes. So just when you find something that your kid will eat, 3 months later, it's going to be something completely different. You kind of got to roll with it.
They keep us on our toes. Thank you so much, Sarah, and great information there as well.
Thanks, Sarah.